In this lecture, we are going to discuss Epstein Barr virus EBV, the most important agent of the infectious mononucleosis. So without wasting time, let's get started. First of all, we will look at the structure of the Epstein Barr virus. It is an envelope virus. Outside, you will see the presence of the envelope, and inside there is a capsid that is made up of protein, and it is icosahedral in shape. And inside there is a genomic material that is double-stranded DNA molecule. That is the general structure of the Epstein-Barr virus. So most important antigens that will be used in the diagnosis of the infectious mononucleosis will be VCA, viral capsid antigen, EA, early antigen, EBNA, Epstein-Barr nuclear antigen, LDMA, lymphocyte determined membrane antigen, and the VMA, viral membrane antigen. So important antigen will be VCA, EA, EBNA. They will be used in the diagnosis of the Epstein-Barr virus infection. Okay, if we look at the transmission, how Epstein-Barr virus transmit from one person to another. So most important source of the transmission will be the saliva. It actually transmits from one person to another through the saliva, specifically during the kissing. So we can also say that it is actually a kissing disease, because in that case the Epstein-Barr virus transmits from one person to another through the saliva. It can also be transmitted through the blood transfusion, but it's a rare case. In the early life, the Epstein-Barr virus infection is asymptomatic, but in later life, in college life, you will see the symptoms of the Epstein-Barr virus will be prominent. Okay, next is the what type of cells will be affected by the Epstein-Barr virus. So two most important cell. First is the B lymphocytes. Okay, here is the B lymphocytes will be affected by the Epstein-Barr virus. And pharynx, oropharynx epithelial cells can also be affected by the Epstein-Barr virus. Here is the oropharynx epithelial cells. But importantly, B lymphocytes will be the prominent component of attack of the Epstein-Barr virus. If we look at the replication, how Epstein-Barr virus replicate. So importantly, you will see the three stages of replication: early, replicative phase, and the late phase. In the early stage, you will see formations of the early messenger RNA, and after that you will see the formations of the early protein synthesis. These proteins are basically enzymes that will be helpful in the replication of the genomic material. In the replicative phase, as we know that the Epstein-Barr virus having double-stranded DNA molecule, that genomic material will be replicated in this phase. Okay, after that you will see the formations of the late messenger RNA, and from the late messenger RNA you will see the synthesis of the late proteins. Now these proteins will be structural proteins. They will be helpful in the formations of the capsid. Okay, so here is the different stages of the replication of the Epstein-Barr virus, and two phases that are most important in the replication of the Epstein-Barr virus. So first is the replicative phase. Two most important phases of replication. First is the replicative phase, in which you will see the replication of the Epstein-Barr virus, and second is the latency phase, when there will be the no replication of the Epstein-Barr virus, but the genomic material of the Epstein-Barr virus will be present in the nucleus of the cell. Here is the two: replicative phase and the latency phase, in which the virus will replicate, and in latent you will never see the replication of the virus in that case. Next, if we look at the pathogenesis, first of all, the virus enter into the mouth through the saliva. Here is the virus that will enter into the mouth through the saliva. Okay, from the oropharynx side, it will enter in our blood. Okay, now after that the virus will enter into the blood, and inside the blood it will affect the B lymphocytes. Okay, the most important, B lymphocyte will be affected by the Epstein Barr virus. Okay, after that B lymphocytes will present the viral component on its surface. Okay, through the major histocompatibility complex. Okay, and after that you will see the cytotoxic T cell, or you can say CD8 positive cell will destroy the infected B lymphocytes. So here is the pathogenesis of the Epstein Barr virus. First of all, the virus entered into the oropharynx. After that, it will enter into the blood, and inside the blood, it will affect the B lymphocytes. And after that, B lymphocytes will present the viral components on its surface. That component will be detected by the cytotoxic T cell. Okay. And if we discuss the immunity, so our body will make two most important antibodies, IgM, that will form in acute phase, and IgG, that will form in recovery phase. Two most important antigens produced against the Epstein Barr virus. Okay, next is the heterophil antibodies. In the Epstein Barr virus infection, you will see the productions of the heterophil antibodies. We will first of all see how heterophil antibodies produce in our body. Here is the Epstein Barr virus. That Epstein Barr virus will make changes in the cell membrane of the cell. Okay, if I say this side of the cell membrane will be affected by the Epstein Barr virus, and Epstein Barr virus will make some changes in the component of the cell membrane, and as a result that component of the cell membrane will act as a antigen, and our body will produce antibodies against that component of the cell membrane, and as a result you will see the productions of the antibodies. So most importantly, these antibodies will not be against the Epstein Barr virus. These antibodies will be against the cell membrane constituent of the cell. These antibodies is basically specific for the cell membrane component, but not the Epstein Barr virus. So these are basically non-specific antibodies, and these are the heterophil antibodies. And they also produce in other diseases like hepatitis B and serum sickness disease. Okay, and these heterophil antibodies disappear after the recovery within 6 months. Okay, so how we will detect these heterophil antibodies? Okay, we will take the horse or sheep RBCs, and we will also take the serum having antibodies, heterophil antibodies. We will combine these RBCs and the antibodies, and if the agglutination is produced, then it means that heterophil antibody is present. But if there is no agglutination, then there will be no heterophil antibodies. So that test is also known as the monospore test, that is used for the detections of the heterophil antibodies. But this test for the Epstein Barr virus is not specific, because that test can be positive in other diseases as well. If we look at the manifestations of the infectious mononucleosis, okay, first is the fever, second is the sore throat, because the saliva is actually present in our mouth. Next is the lymphadenopathy, splenomegaly, due to the proliferation of the lymphocytes, and anorexia and lethargy. You can also see the hepatitis as well, hepatitis and encephalitis as well. So here are basically the manifestations of the infectious mononucleosis, or you can say mono. If we look at the complication, so most important, nasopharyngeal carcinoma, hairy leukoplakia, Burkitt lymphoma, PTLD, post-transplant lymphoproliferative disease, and HLA, hemophagocytic lymphohistiocytosis. So there are basically the different complications of the Epstein Barr virus. If we look at the lab diagnosis, so as we have discussed, monospore test for the detections of the heterophil antibodies. Okay, next is the antibody detection, specifically against the viral capsid antigen early antigen and Epstein-Barr nuclear antigens. We can detect the antibodies against these three most important antigens of the virus: VCA, EA, EB, and A. And last is the PCR. And along with that, we will also check the lymphocytes. And we will see the absolute lymphocytosis. Lymphocyte count in the CBC report will be high. Absolute means we report the lymphocyte in the CBC report in two forms, in percentage and in absolute count, like 4,000. So in the mononucleosis, you will see the lymphocyte count, absolute lymphocyte count will be high in that case. And you will also see the atypical lymphocytes. This is mostly CD8 positive cytotoxic T cells. When the cytotoxic T cell interact with the B lymphocytes, and as a result, you will see in peripheral smear atypical lymphocytes, in which you will see the large lymphocytes having large nucleus, and the amount of the cytoplasm will be large in that case. These are basically the A lymphocytes. If we look at the treatment, so in the treatment, we will give the supportive therapy. So this is all about the Epstein-Barr virus. If you still have any question, you may ask in the comment section. Thank you so much.